कैसे आने स्टार्ट कर दूँ? हाँ स्टार्ट कर दो। हाँ बस अब मैं शुरू करो पीछे आराम से मास्क सिखाऊंगी।
Hello, Assalamu alaikum. Bismillahirrahmanirrahim. I am Dr. Fareen Amir and today I am going to present a lecture on RH incompatibility in pregnancy or RH isoimmunization. Now, what is the definition of RH incompatibility? It is a condition which develops when there is a difference in RH blood type between that of the pregnant mother, RH negative, and that of the fetus, that is RH positive. Now this is the picture that is showing immunized pregnancy and a non-immunized pregnancy. In this immunized pregnancy, there are antibodies formed that will act on the fetus. Now what is RH blood grouping system? It was first demonstrated in RH rhesus monkeys. This blood group is classified as RH positive or RH negative. The genotype is determined by the inheritance of 3 pairs of closely linked allelic gene situated on chromosome 9 named as D, D, CC and EE. Now what is RH factor? The rhesus factor gets its name from experiment that is conducted in 1937 by two scientists. Their experiment was involved the rabbits and the monkeys. They injected the rabbit blood into the rhesus monkeys' red blood cells, which produce an antigen that is present in the red blood cells of many humans. Now this is the picture. As you all know that there are 4 types of blood group, that is A, B, AB and O. Each blood type is additionally classified according to the presence or absence of RH factor. So this is the picture that is showing that each blood group has agglutinogens and agglutinin. Now RH type, and what is RH type and pregnancy? A person's RH type is generally most relevant with respect to pregnancies. If the pregnant woman and her husband are RH negative, there is no reason to worry about RH incompatibility. But if the pregnant lady, if she is RH negative and her husband is RH positive, the baby will inherit the father's blood type that will create incompatibility between the mother and her fetus. In some of the fetal blood type, fetal blood, that is also red cells, or it also known as foreign antigen, when it gets into the mother's bloodstream, her body will produce antibodies. In first pregnancies, they will form IgM antibodies that will cannot crosses the placenta. So the pregnancy is not at risk. But re-exposure in subsequent pregnancies causes the primed mammary B cells to produce IgG and antibodies which crosses into the fetal circulation. These antibodies could pass back through the placenta and will harm the developing babies red blood cell, causing very mild to severe anemia in the fetus, which can also lead to increase in the cardiac output and causes eventually the fetal death. It is also referred as known as immune hydrops. In mild cases, the hemolysis can lead to fetal, neonatal or fetal jaundice or anemia. Now, what is the pathophysiology behind it? Usually, placenta act as a barrier to fetal blood entering the maternal circulation. However, sometimes during pregnancy or birth, feto-maternal hemorrhage can occur. The woman's immune system reacts by producing anti-D antibodies that causes the sensitization. Okay, this is the picture which is showing that there is a placenta which is the barrier between the fetus blood and the mother circulation. This is the picture that is showing hydrox fetalis, that is the accumulation of the fluid over the viscera. Um, Now this is the picture which is showing that when there is a breakage in the placenta, so the fetal positive blood cells will circulate in the maternal blood cell, and in the next picture showing that antibodies are formed. When there are subsequent pregnancies, these antibodies can cross the placenta and will destroy the fetal erythrocytes. The hemolytic disease of fetus and newborn caused by Rh isoimmunization can occur during the first pregnancy, but usually sensitization occurred and in the first pregnancy, and the birth lead to extensive destruction of fetal red blood cells during the subsequent pregnancies. Now this is the picture that is showing the potentially synthesizing events. So these are the causes, or these are the events that may lead to Rh immunization. These are abortions, ectopic pregnancies, partial mole, antepartum bleeding, that could be placenta previa or abruptions, any procedure like amniocentesis, chordiocentesis or CVS, external cephalic version if there is platelets transfusion, any blunt abdominal trauma, or if the patient is transfused with Rh positive blood, postpartum or delivery itself. Now this is the summary that is showing that the red blood cells negative, there are fetal in maternal circulation, and positive blood cells in fetus. Then in the next picture, they will break the placenta, the fetal cells, and they will circulate in the maternal circulation, and then antibodies are formed. And in the third one, the antibodies circulate back into the through the placenta to the fetus and causes harm to the fetus. Now, how can the detection of Rh incompatibility can be done? There are no any physical symptoms that could be seen in the Rh incompatibility. If the woman just found out that she is pregnant, she should undergo a blood type and test. This test will determine her blood type and Rh factor. Blood test that will determine whether she is Rh positive or Rh negative. All women with Rh negative should be checked for antibodies level at booking, at 28 weeks and at 34 weeks. The PCR of fetal cell in maternal blood may also determine the fetal blood group. Now, when we are going to check the antibodies level, if the levels are positive but they are low, it means they are 4, 3 or 6, but they are less than 10 international units per ml, then we have to do these levels after every 4 weeks. If these levels of antibodies are greater than 10 international units per ml, then we have to go for fetal assessment for anemia. There are we assess the fetus by three means of way: by amniocentesis, by fetal blood sampling, or we can perform middle cerebral artery Doppler ultrasound. First, we are going to do the middle cerebral artery ultrasound, in which we can see or we can measure the peak systolic velocity. Now, if the peak systolic velocity is normal, if it is less than 1.5 mom, that is medians of mole. If it is less than 1.5, that is normal, then we have to go for a middle cerebral artery Doppler once in a week if it is normal. But if it is abnormal, that means that it is greater than 1.5 mom, then we have to go for fetal blood sampling, and if needed, then we have to do the intrauterine blood transfusion. Now treatment, when we do the fetal blood sampling, if fetal hematocrit is less than 30, means the fetus is anemic, then we have to transfuse irradiated Rh negative, CMV negative, cytomegalovirus negative PEG cell volume transfusion. It could be done in umbilical vein at the cord site or into the hepatic vein. The transfusion can be done from 18 weeks onward. If the pregnancy is at term or the pregnancy is at 34 weeks, then it is better to deliver the fetus. The transfusion can be repeated either after every 2 weeks because hemolysis is continued. So we have to transfuse after every 2 weeks, or if the middle cerebral artery Doppler become abnormal. Now how can we prevent it? Its prevention is by using special immunoglobulins, beta-ROGA, that is anti-D, and it is given at 28 weeks of pregnancy. If the baby is born Rh positive, another dose is administered within the 72 hours after delivery. This will prevent her body from creating any future antibodies that could cause harm during a pregnancy. Now, the dose of anti-D is which we are going to give is 1500 international units, and it is given to all the Rh negative women that can be given routinely at 28 weeks within the 72 hours of any potentially synthesizing event, or after the delivery of the neonate if the neonate is Rh positive, or it can be given within 10 days of the delivery. Now postnatal, baby is delivered. Now we have to see the baby for anemia. If the baby is anemic, then we have to transfuse the baby. If there is jaundice and it is of mild, then it mild, then we have to give phototherapy. And in moderate to severe cases, we have to give exchange transfusion. Now this is the picture showing fetal hemolysis. This is the picture showing jaundice baby. Now, what is severe form of Rh incompatibility? In severe cases, these are the complications that can be occurred in the fetus. This is hydrocephalus. First one, massive fetal red blood cells destruction will lead to overall swelling of the fetus, all the viscera and the skin of the baby also. In severe cases, it could lead to anemia, fetal heart failure, death of the infant shortly after the delivery, and total body swelling, respiratory distress in the infant if the infant has been delivered, circulatory collapse, and it may cause conjunctivitis, that is a neurological syndrome in extremely jaundiced infant. It occurs several days after the delivery and is characterized initially by the loss of mororeflex, poor feeding, and decreased activity. Later on, at last, it may lead to death of the child immediately after its birth.